Good afternoon, and welcome to today's caregiver webinar, Family Caregiving and Managing Chronic Diseases. My name is Allegra Jaffe, and I am the supervisor of the Caregiver and Supportive Service Unit with the Fairfax Area Agency on Aging. A few housekeeping items before we begin today's session. Today's presentation is being recorded. A link for the recording of the session and the slides will be sent to everyone a week from today. We have enabled closed captioning. So if you would like to utilize the closed captioning, on the bottom of your Zoom bar, you can choose to enable that. We don't have chat, but we do have Q&A. So if you have questions, you can put them in the Q&A box. And at the end of the session, about 10 to 15 minutes, we're going to try our best to get in as many questions as we are able. Also, at the end of the presentation, there will be a brief survey. It would be really helpful for you to fill that out and let us know what topics you're interested in for our next year's programming. And now I would love to introduce today's speaker, Bobbie Beharrie. Bobbie is a registered nurse with an extensive background and experience in healthcare field. She has worked in the long-term care industry, serving clients for over 40 years. Her experience stems from the nursing home to assisted living communities, with the last 14 years serving as Director of Personal Care Services with the Medical Team Home Care Agency. Bobbie's desire is to serve clients in any way possible and to help them age in place gracefully in the comfort of their homes. Bobbie's credentials include a CDP, Certified Dementia Practitioner, CADDCT, Certified Alzheimer's Disease and Dementia Care Trainer. Thank you so much, Bobbie, for being here today. If you can come join me on camera and unmute, and I will let you take it away. All right, Bobbie, thank you. I'm going to switch screens for us.
Okay. Good afternoon. Good afternoon. Hello, everyone. And thank you, Allegra. Thank you so much for inviting me to participate in this webinar this morning. And also thank you, audience, for allowing me to come into your home to present this presentation on managing chronic diseases, just how it impacts everyone that's living with these diseases, how we can manage it, and ways to prevent managing chronic diseases. Next slide, please. So when we talk about chronic diseases, exactly just what is the definition of a chronic disease? So just know that chronic diseases are health conditions that can last anywhere from a year and something that requires ongoing medical care. Or maybe it just limits your daily activities. Things that you used to do, you find yourself not able to do them anymore. Examples, climbing up steps at home or just getting in your home, period, if there are a lot of steps going to your apartment. So some examples of chronic diseases, there's many chronic diseases, but a few just to name: heart diseases, cancer, diabetes, stroke, arthritis, hypertension, Alzheimer's disease, even obesity. Obesity is a chronic disease also. So today we're going to talk about how to manage some of these chronic diseases and really focus on diabetes and hypertension. Next slide, please. So in managing chronic diseases at home, we know that living and with managing chronic diseases can present numerous challenges. Again, like I said, things that we weren't able to do, not able to do them anymore, or needed help to do the things that we used to do. But just understand and know that with proper management and support, that we and individuals with these chronic diseases can live a fulfilling lives. So again, in this presentation, we're going to explore strategies for managing chronic illnesses at the home and providing support to those that are affected. And also the respite for the caregiver that is living with or helping someone with the chronic disease. So just know that from coping strategies to effective management techniques. So what we're going to do is we're going to delve into the needs, the challenges, and different ways to navigate life when you're living with a chronic condition. Next. We're going to look at a couple of things to manage these diseases. First, let's talk about regular medical checkups and monitoring your diseases at home. Please, please, please continue to see your doctor, to schedule your routine appointments with your healthcare professionals, and you want to be able to monitor your condition at home. Just know that you are part of the healthcare team. You are part of the team that's managing your illnesses. So please make sure if you think of anything, jot it down. If you know that you have a doctor's appointment coming up next month and you're feeling this way, jot things down so that you would know what to talk to your healthcare providers about when you do have that uh, appointment with your doctor. You want to create a structured routine and daily management plans. Again, establishing a structured routine that includes your medication schedules. Please, we should not be skipping medications. And I know sometimes, we do forget, did I take my medicine this morning? Did I not? So sometimes you may even need to get a weekly pill box to make sure that you're filling it. And the best thing to do is to fill it on Sunday evenings so you have your medications in there for the week, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, Sunday. And there are medication boxes that you can either get the one once a day, and there's even some that are 4 times a day. You have the morning, your noon, your evening, and bedtime. And also there are monthly medication machines that you can get where someone can fill your pill box for the month and it will beep to let you know that the pill is ready. So make sure that we are taking our medications on time. Meal planning is very important, especially if someone talking about high cholesterol, diabetes, hypertension. You want to make sure that you're eating well and eating correctly. Exercise. We all need exercise in our life, and it's not just to lose weight, but exercise is for heart health also. It keeps your heart healthy for diabetes. It helps to control your diabetes even, and we'll talk a little more about exercise. Just getting a few minutes in a day can make a big difference. We want to make sure that we are getting proper rest, at least 7 to 9 hours of sleep a day, and then any other self-care activities. And self care activities could be anything that you enjoy doing. For me, my self care activities is I like to go to the mall and walk around shop, even if it's not buying anything, just to look around. So, your self care activities could be going to the beauty salon, it could be golfing, or maybe biking, dancing. So, whatever it is that you enjoy doing, try to continue to do that. The next one is adapting the living environment. So sometimes you might need to get grab bars for your bathroom if you find yourself falling in the shower. Have someone come in to install grab bars in your home. Or maybe if you have a lot of steps going up to your front door, you may need to get a ramp put up. So, or any type of adaptive equipment in the home, anything to make it easier for you to live in your home. Next slide. Now, and also when we talk about ensuring proper medication management, again, make sure that you're not skipping your medication, make sure that you're taking it as prescribed, and engage in preventive care and disease management strategies. Again, following your recommended measures, such as if right now we're in the flu season, so we want to make sure that we get our flu shots. If you have not gotten your last COVID shot, make sure that you're getting your COVID shot and just regular screenings, your mammograms, your prostate screenings, make sure that you're going in to get those done. And next, you want to seek community resources. There are, especially in Fairfax County, there are many, many resources. There are many support groups out there. So please connect with your local support group, call your area agency on aging and see what type of support groups might be out there for you or your loved one. And there's different organizations, community resources that you can tap into. So again, please contact your local area on agency to see what support groups, what resources are available in the community for you for your particular type of chronic illness. Again, advocate for yourself. I talked about that earlier. You want to make sure that you take an active role in your healthcare journey. Again, this is your journey. It's your body. You know your body better than anyone else. So ask questions, talk to your doctor. Again, like I said, write things down so that you can remember, or have a loved one to write it down, or go to the doctor with you. And make sure that you voice your concerns when you're talking with your healthcare provider. Be assertive of your needs and ensure that you receive the best possible care and support from your loved ones and from your healthcare providers. Next slide. Now, we want to talk about some presence and support that can make tremendous impact on you. Again, we're talking about managing chronic illnesses at home require a comprehensive approach that includes coping strategies, effective management techniques, and strong support system. That is so, so important to have a strong support system, whether it's in the home, whether it's in the community, whether it could be in your church, your local group in the community, but just make sure that you have some type of support system in place. So by implementing these strategies and offering support and understanding the unique needs and challenges of people that living with chronic illnesses, that we can help them live a fulfilling life and improve their overall well-being. Because this is what it's all about, is helping people live a fulfilling life and their overall well-being. So remember, ask to seek professional guidance and utilize the resources that are there for you in your community. Next. So if you have a loved one that's living with a chronic illness, there's a couple of things that you can think about. Number one, provide emotional support and understanding. The person that is going through the illness, please offer a listening ear, empathize with them, and validate what they're feeling versus saying, oh, you shouldn't feel this way. Oh, this is not going on. This is what they're feeling. So we want to validate that and just understand that living with a chronic illness, it can be challenging. It can be challenging both physically and emotionally. So we want to be that support system for our loved ones that are living with this chronic illness. Number two, assist with daily tasks and chores. Offer help. Offer help with them, say, to come over to do some house cleaning. You might want to prepare a meal for them, or sometimes prepare a meal for the week. It's something that they can put in the freezer and just take out and heat up in the microwave. So you want to prepare some meals for them, or sometimes even offer transportation, taking your loved one to the doctor's appointments when needed. And that is so important also, because that way you can be in the room with the exam room when they're examining the person, so that you can hear what the doctor or the healthcare professional is saying. And just these small gestures can make a really significant difference for the one that's living with the illness. Number three, we want to accompany them to the medical appointments and treatment. Again, like I said, just offer to take them to appointments. Sometimes people don't ask for help, but if you offer the help, then they will accept that. Number four, you want to encourage self-care habits. Again, support their self-care routine by reminding them to take breaks. Not you don't have to do everything at once. So take breaks when you're doing things. If you need to take naps throughout the day, take a nap throughout the day. Encourage them, again, to eat healthy and engaging in activities that promote relaxation and well-being. Some people, it might be knitting. So if that activity promote relaxation for you, then knitting is good. It could be coloring, coloring books or word search or anything that give them that relaxation and well-being. Number five, be a listening ear. Sometimes people just need someone to listen to them, not so much giving advice and telling them what to do, but just be available to listen without judgment, not giving any judgment, but provide encouragement and hope and reassure them during some of these challenging times. Next slide. Now we want to talk about, like I said, there are several chronic illnesses, but one we wanted to talk about today is diabetes. And I know there are a lot of people living with diabetes or pre-diabetic. So diabetes is the seventh leading cause of death in the United States. And it impacts more than a quarter of people over the age of 65 and older. So what we need to do is finding and treating diabetes early, detecting it early could mean preventing or delaying many of the other health problems that diabetes bring on. And we'll talk about some of those other health problems that could occur if you have diabetes. So nearly 30% of older adults in the United States have diabetes, which makes it hard to control your blood sugar, and it can lead to other issues, again, like heart disease and stroke if you don't manage your diabetes. And just know that Medicare will cover, and I know most people do have Medicare, Medicare will cover the cost of the prescriptions and the equipment you might need, the blood sugar strips, insulin pumps, and other type of medications. Lifestyle changes. So lifestyle changes in your diet and exercises not only help to relieve diabetes related health issues, but it can possibly prevent type 2 diabetes. So we'll talk about some of these life changes here. And also, excuse me, know that diabetes is a chronic disease and it occurs in the body, and it doesn't, which means that the body doesn't produce enough insulin, or maybe no insulin at all. And what is insulin? So insulin is the hormone in your pancreas that makes help to make the food that we eat change the blood sugar known as glucose. And they change that glucose into energy from the food that we eat. That's why it's very important to eat balanced diets, to eat the right foods when you have diabetes. Because without insulin, then too much glucose builds in your blood, and then that can lead to some of the following issues that I said that we will talk about now. So when you have too much glucose built in your bloodstream, it can lead to heart diseases, it can lead to kidney disease, stroke, eye health issues such as vision loss and blindness, and nerve damage. And when we talk about nerve damage, that's why sometimes you don't feel, especially in your foot, your leg, your toes, you don't feel when there is an injury. You don't feel when there's a cut or something like that because of the diabetes. It damages the nerves. Next slide. So diabetes care management, it takes work. It's not easy, but just know that you can live a healthy and active life with diabetes if you stay on top of your health and well-being. And so these are some of the areas that you can help to manage your diabetes. Again, medical care. Make sure that you are going to your doctor. Make sure that you are keeping your appointments. So a doctor could prescribe many medications or multiple medications to help manage your diabetes. And some of them, it might be insulin. So insulin is the medication that converts glucose in your blood into energy. So the glucose now, when you're taking the insulin, it converts the glucose into energy. And it is often taken as an injection. And most people can do their own insulin injections, but there are different types of insulin that a doctor could prescribe. And it's based on the factors such as your age, your physical activity, and what you eat. So everyone might not be on the same dose of insulin, and you might not be on the same type of insulin. Or the doctor might even put you on two different types of insulin, again, depending on that's why it's an individual thing, not a cookie cutter. There are also oral medication. There are many diabetes medications that you can take by mouth that will lower your glucose level. The most common one that the doctors do prescribe nowadays is called metformin. And what metformin does, it reduces the glucose in your liver. That makes it easier for your body to use the insulin. Next slide. Again, with diabetes, make sure that we are eating healthy. So when managing your diabetes, it is important to eat a balanced diet, the foods that would not spike your glucose level. So this means limiting or steering clear of food and drinks that's loaded with sugar. Instead of doing that, try to eat meats that are lean in proteins, healthy fats, and carbohydrates filled with vitamins, fibers, and minerals. Because what happened is the starch and sugars in carbohydrates or carbs, as we call them, they can raise your glucose level. So it's best to eat nutrient rich ones like broccoli, green beans, anything that has protein and fiber in it. And the thing about it, even like I said, not skipping a meal, you should be eating breakfast, lunch, and dinner, and even snacks in between, but healthy snacks in between. And we always tell our clients also, even at night, after you eat dinner at night, it is still best to eat a snack or something just before going to bed. Because, and when we eat something healthy, protein, like maybe peanut butter crackers or something, but just make sure you're eating something before you go to bed at night, because what that does is kind of keep your glucose level instead of, it will go down easily versus dropping down while you're sleeping. So make sure that you eat a snack or something before going to bed. And what the Centers Disease Control and Prevention recommend is, if you think about a plate, a 9-inch plate, half of that should be non-starchy vegetables. So if you just kind of imagine, if you have a 9-inch plate, just in half of that plate should be your non-starchy vegetables. You got your broccoli, you got your carrots, you got your green beans, and then you will split the other half into lean protein. That's your fish, that's your nuts, that's your carbohydrates, like your whole grain pasta or beans and stuff like that. So make sure that you are eating healthy, and you want to stick with water as a beverage instead of the sweet drinks. The sodas are loaded with sugar, loaded with calories. So we want to drink water, and a lot of people don't like water. If you don't like water, get water and squeeze a lemon in it or a lime, or some people even put fruit in their water just to give it a better taste. Me, I like water. I don't like things in my water, just plain water. But if you don't like plain water, you can either get these little packets that have the flavor in it, put it in there. It doesn't have the sugar in it. So, but it will kind of taste better for people that don't like plain water. Next slide. Activity, physical activity. Get out, get moving. Basically, getting 30 to 45 minutes a day of moderate exercise, it really can keep your glucose level under control. It also helps to reduce your bad cholesterol and high blood pressure also. And not only that, with weight. So, and we're not talking about going to the gym every day, doing extensive exercise. It's just going for a walk. And if the weather is bad in the apartment, walk up and down the hallway, even if it's 10 minutes, 15 minutes. If you do 10 minutes twice a day, morning and evening, that's fine too. So older adults, what we can do, we can get workout from different activities. Dancing. There are people that love dancing. That's good exercising. If you're dancing for 10 minutes, 15 minutes, turn your TV on to any type of they have these YouTube channels where you have different workouts, different activities, dancing, walking. Like I said, get outside and walk for 10, 15 minutes or inside your building, whichever works good for you. Lifting weights for people that are able to do that. Some people like yoga. Nice and is it with your mind, body, spirit, everything. So if yoga is your thing, try yoga. Bike riding, swimming. A lot of people, there are lots of gyms out, YMCA, different community centers that have pools. Join them. And they have dancing there, they have swimming, they have different type of exercise groups. So, and just know that you can break up these however you want. Like I said, if you do 10 minutes, 10 minutes, 10 minutes, or 15 minutes, 15 minutes in the morning, in the evening. But the important thing to do is you get your blood pumping. So get out, walk, yoga, bike ride, swimming, whatever you like to do. But just don't do it too hard at first. Take your time, slowly move into it, and then you can advance to a higher intensity workout. But make sure that you talk with your healthcare provider and make sure that it is okay for you to do some of these activities. And sometimes they will tell you what might be best for you depending on what your illness is. Again, there are many senior centers out there that have they have line dancing. People love line dancing. I used to go to I think it was at Ollie Glen. They had classes on twice a week on line dancing. So you can go to some senior centers. There's other community centers that does offer physical activity programs, and they are fun. They're engaging. You get to meet other people. So again, that goes with your just socialization also. So just remember, 30 minutes a day, whether it's 15 minutes in the morning, 15 minutes in the evening, even if it's just walking, you can do that. Next slide. Next slide, please. Okay, and if people ask, how do you prevent getting diabetes? Really, there's no way to prevent type 1 diabetes. However, there are lifestyle changes that you can make to prevent type 2 diabetes. So again, because most type 2 diabetes cases begin with pre-diabetes. So it's important to test your glucose level, which can be done on a regular checkup at your doctor's office. And if you have risk factors for diabetes, reducing these risk factors is vitally important in preventing diabetes. So if your glucose level indicate pre-diabetes, here's some of the things that you can do to try to reverse that. Again, we talk about your weight. Make sure that you keep your weight at a good weight goal. And if you have a goal for your weight, let's work on that. Follow a healthy eating plan, what we talked about earlier. Get physical activity, get out there and walk, bike, swim, whatever, and keep track of your progress on a monthly basis, on a weekly basis if you want to. So you want to keep track of that so that when you go to your doctor, you have something to show them of what you have been doing. Okay, next slide. So we talked about diabetes. Now we want to talk about hypertension. Hypertension or high blood pressure, as some people call it. So what is hypertension? So hypertension, also known as high blood pressure, is often called a silent killer. And the reason it's called a silent killer because sometimes people don't have symptoms, or they might have symptoms and ignore them or not do anything about it because it's mild symptoms, like maybe, oh, I have a little headache, everything is fine. But high blood pressure quietly damages the blood vessels. So when the pressure is high in the vessels, it can damage them, which lead to serious health problems. And again, there's no cure for high blood pressure, but taking your medications, changing your lifestyle, making some lifestyle changes can greatly improve your quality of life and control your blood pressure. So these actions also can reduce your risk for heart disease. Like I said earlier, high blood pressure can lead to other illnesses, chronic illnesses such as heart disease, stroke, and kidney disease. And there's other illnesses too. So maintaining your blood pressure, keeping it at a normal level for you. And you need to know what your blood pressure level is, what is normal for you, because everyone's blood pressure normal might be different from someone else. So that's why it is so important to keep a log, get a calendar, logbook, or something, and keep track of your blood pressure so you would know what is normal for you. Next slide. Know your numbers, as I just said. So is your blood pressure in a healthy range? The best way to know is to get your blood pressure checked. And I know going to the doctor, yes, sometimes, why does it happen? When you go to the doctor, your blood pressure is always elevated. Do you know what that's called? Yes, that's a white coat syndrome. So that's why it's best to take your blood pressure at home. Have a log so when you go to the doctor, whether you're taking it daily, whether you're taking it once a week, whether you're taking it every other week, that way you will have a log, a record of your blood pressure versus every time you go to the doctor, your blood pressure is high. And that's because you get anxious, the white coat syndrome, and that's normally, your blood pressure is higher. So do you monitor your blood pressure regularly? So if you are diagnosed with high blood pressure, you should monitor on a regular basis, but know what your numbers are and see whether there's a change after a week or two. Tracking your results over time will also show if lifestyle changes that you've made are working. So a lot of times, you might be on medication and now you have changed some of your eating habits, you're getting out there exercising, but how do you know if your blood pressure is lowering or not? So that's why it is such a good idea to keep track of your numbers so you know whether it is working or not. A lot of people, they say, oh, well, I'm taking medication, I'm exercising, I'm doing this, but my blood pressure is still high. Sometimes it's like what we're eating that could be increasing our blood pressure, or we're eating too much salt, and we'll get into that in a minute also. So next slide. So again, knowing your numbers. Now, this is from the American Heart Association, where they look at your top number, which is your systolic, and your bottom number, which is your diastolic. Okay. So a normal blood pressure, systolic top number should be less than 120, and your bottom number should be less than 80. So you will see people say, okay, my blood pressure was 120 over 80. That's the top number is the systolic, and the bottom number is the diastolic. Now, that's normal, 120 over 80. If it goes into the 120 to 129 for your top number and less than 80 for your bottom number, now your blood pressure, they look at it as elevated. Again, at this point, your doctor probably won't put you on medication, just monitor it. When it get into the range of 130 to 139 of your top number and 80 to 89 of your bottom number, now you're in hypertension, stage 1. Again, that's not too bad, but you want to monitor it. The next stage, what they call stage 2 in high blood pressure, if that top number is 140 or above and your bottom number is 90 or above, yes, that is stage 2 diabetes. Hypertension. You probably will be placed on medications at this time. And your doctor will tell you to change some of your lifestyle changes. And then with the last one, which is stage 3, you really need to get to your doctor right away when your top number is 180 or above and your bottom number is 120 or above. And I have seen people with their blood pressure like 190 over 140. Wow. Yes, you need medication. You need to go see your doctor, and maybe some other tests might be done to see what else is going on to make sure that your blood vessels are not damaged. Next slide. Now, when we're talking about some lifestyle changes for hypertension you can help manage your blood pressure, again, eating healthy foods. Choose a heart-healthy diet that includes lots of fresh fruits and vegetables, and aim to recommend amounts of potassium, which is the normal potassium should be 4.7, and fiber should be at least 25 grams of potassium and fiber you should be getting a day. And you can also try eating more small amounts of dark chocolate or cocoa powder, which contains flavonoids that help to reduce or help the blood vessels to dilate. Because that's what you want to do, is get the blood vessels to dilate so that the blood can flow easier. Can you take me off that for a minute? I just want to show something. So when we're talking about choosing the right foods, okay, you guys can see me. So it's good to read labels. So when you're reading labels, you want to see how much sodium is in the foods that we're eating, right? So when you go to the grocery store, and I just picked a couple of things from my cabinet this morning, actually, okay, which this should not be in there. When my husband had COVID a couple of months ago, had no taste, so I stocked up on soups because he had taste for nothing. But if I look at this label on soup here, this says for sodium, there is 707 milligrams of sodium, and this is in a half can. If they were to eat the whole can, it is 1,680 milligrams in a can of soup. That is crazy, crazy. So I know a lot of people say it's easy, it's cheaper, so they eat a lot of soups, but please, please look at the sodium. So all you have to do is read the label, the nutritional facts here. And this can of soup, and this is a good soup. This is a vegetable soup. This is by Campbell's Chunky Vegetable Soup, but it has, for a half can of soup here, it is 707 milligrams of sodium, which is 33% of our recommended daily. So really, you shouldn't be eating nothing no more than 5% of sodium, and this is 33% for half the can, and it is 73% if you eat the full can of soup here. So pay attention to your foods, especially canned foods. I know we like to stock up with canned goods, but please look at the label and read the sodium content on it. And anything over 5%, maybe even 7%, you really should stay away from and eat more fresh vegetables, fresh fruits. Back to share my. So the next thing we talked about, changing your diet. Number 2, again, exercising. Regular exercise, try to get at least 30 to 40 minutes of moderate exercise a day. We talked about that. Again, maintaining a healthy weight. You know, with diabetes, sometimes just losing weight can help manage your diabetes also, because when you're overweight or obese, what that does, it makes it harder for your heart to work. It's harder for your heart to pump the blood. So losing weight can help reduce your risk of heart diseases and stroke, like I talked about earlier. Number 4, limit your alcohol intake and your caffeine. Alcohol should be no more than 1 drink a day for women and 2 drinks a day for men. So if you need to cut back on alcohol or even caffeine also can is a risk factor for hypertension. So you can also try to cut back on your caffeine, and caffeine is found in, of course, coffee, tea, even lots of sodas have caffeine in it. Next slide. Number 5, smoking. If you do smoke, try to quit smoking or limit your cigarette intake during the day, because smoking, what it does, it damages the blood vessels, which increases your risk for high blood pressure, again, stroke, heart attacks. So again, cease smoking, or at least limit your amount of cigarettes that you're smoking per day. Number 6 will be managing stress. I know that's easier said than done. Stress is all around us. There are some things that we have no control over that causes stress, but just try to avoid things that cause you stress. Sometimes you have to just walk away from something. Sometimes you have to change things around. There could be people in our lives that we need to just stop associating with if that person causes us stress. So try meditation or yoga, anything to de-stress us. Like I say, when I'm stressed out, sometimes I just like to go shopping. Then I get stressed out even more because I shop too much. But find things that you like doing, that you want to manage your stress. And you can also try to take time for enjoyable activities or hobbies, whether it's knitting, whether it's making scrapbook or anything. So try something that you enjoy doing. Make sure you get enough sleep. We want to aim for at least 7 to 9 hours of sleep a day. Okay. And also monitor your blood pressure. We talked about that earlier, is that keeping a log of your blood pressure at home is better, because when you go to the doctor, here they talk about the white coat syndrome again, which is when anxiety elevates your blood pressure. Now you have a higher reading at the doctor's office. You might say, well, I just took it yesterday and my blood pressure was 130 over 82. Now you took it, it's 172 over, 98. So that's because in the doctor's office, sometimes, not everyone, but sometimes your blood pressure do elevate when you're in the doctor's office because you're anxious, because you have a doctor's appointment. And again, that's called the white coat syndrome. Next slide. And just know that managing blood pressure is a lifelong commitment. It is. So it's important to work with your healthcare providers to manage your blood pressure. And just know that you are part of the healthcare team. It's you, it is your body. So you and your healthcare professional, you guys are partners. You're partners in this. So please make sure that you're asking questions, anything like that, and learn about high blood pressure. So if by adopting a healthy heart, healthy lifestyle, you can reduce your blood pressure, prevent or delay the development of high blood pressure, improve how well blood pressure medication works. It lowers your risk of heart attack, stroke, heart failure, kidney damage, vision loss, and sexual dysfunction. So we want to make sure that we're doing things at home to lower our blood pressure and to live a fulfilling life. Next slide. Again, we talked about eating 8 to 10 servings of fruits and vegetables a day. Eat foods that are low in fat. And again, here's the exercise again, whether it's just get out and walk. Get out and walk. Now, even when I was talking about going to your doctor and having things ready, another thing you can do, I want to share with you, is a file of life. So if we can get the screen back, let me show you what this is. So a file of life, this is a document that you can fill out, and this is what it is. There's a magnetic on the back where it can go right on your refrigerator. So when you're going to the doctor or loved ones, everyone will know what your health condition. So it's a nice form here. And I would suggest when you fill this out or have someone to fill it out, to do it in pencil. Because when you do it in pencil, then you're able to erase if you're not on this medication anymore, the doctor have discontinued this or ordered a new medication, you're able to change it up. So it's best to do this in pencil. But it has, of course, your information. It has emergency contact. Who would you like to be your emergency contact? Their names, telephone numbers. It have all the medications that you're taking. You are to write it on here, and your diagnoses and your doctor's information. So this is very important, a very helpful tool to have. It is called a file of life. Let me show it again. This is what it is, a file of life. And you can get this, a lot of fire stations will have them. Sometimes if some area on agency might have them in their offices and stuff, but I think you can also order them offline. I know for different programs, communities, like we just ordered a bunch of them, but you can order individual also for the file of life. So make sure this is very important, very good to have in your household. That way you can have it right in your purse if you want to. And there's also smaller ones, wallet size, that you can fit in your purse. Okay, we're going to get back to our slide and we're almost done. So the summary, so now we're talking about summary and conclusion. The takeaway here is just remember that chronic disease management is a holistic and ongoing process. But if you different lifestyle changes, medications, and self-management techniques are essential for chronic illnesses, and support from healthcare professionals, support from your family, support from your community, and don't be afraid to ask for help. All of these things can improve your outcome. Final thought we want to talk about, just know that with the right tools and strategies, people that are living with chronic diseases, you can live a fulfilling and healthy lives. Just put some of these measures in place, ask for help, and engage with your community, engage with your church, and anyone that can help you, your local area-owned agency, your local community centers, all of this to help you live a fulfilling and healthy life. Now, I think we will open up. Allegra probably will have any questions anyone have for us.
Yes. Thank
And
you.
I want to thank you so much for your time.
Thank you so, so much, Bobbie, for this great presentation. And so, folks,
Yeah.
yes, we have a few more minutes left, so you can put in your questions in the Q&A box. And before I forget, I did want to mention to everyone, as Bobbie said, the File of Life, if you live in Fairfax County and you're joining us from Fairfax, the fire department does have that. So you can connect with the fire department and they can get you a File of Life. These are free of cost to our community members. And as she mentioned, I'm with the Fairfax Area Agency on Aging, and we have a private partnership with Inova Health Systems, ElderLink. And I wanted the community to know that ElderLink does have chronic disease self-management education programs. These are free of cost workshops. They do chronic disease self-management. They have a diabetes self-management program and a chronic pain self-management program. And these are programs for family caregivers and the people who are living with chronic diseases. So we do have a lot of other resources. Connect with us if you're looking for any of those classes or the File of Life that Bobbie mentioned. And let's jump into those questions. Okay, so Bobbie, we have someone who asked, how much does 5% sodium equal?
So it depends on, you look at I don't know if you can show this again. So you're looking at the label. Okay, so if you're looking at the ingredients label on the bag, it will tell you for this one, for instance, I'm going to look at the sodium level on this one is 770 milligrams, which equals to 33%. So basically, if you're talking about 5%, then you want something that is lower than at least 200 milligrams of sodium in that particular food. And the thing about it is that some things that you think might be low in sodium, really they're high in sodium. And things you think might be high in sodium might be lower than you think. And you want to look at the servings per container, because someone will look at this and say, okay, there's 770 milligrams in it, but this is for 2 servings. And another thing I wanted to show, this is part of my snack that I have for today. I'm unfortunate they are potato chips. Okay. But these chips is 8 servings per container, and 1 serving is about 15 chips. So just think, if you're sitting, snacking, you're like, oh, 15 chips, that's a lot. But no, 15 chips is nothing. You can go through 15 chips in a second. So if 15 chips, and for sodium here, 15 chips is 90 milligrams, which is 4%. So if I'm doing about 3 of these servings, 4 times, 3 times 4, that's 12. So that's already 12% because you're snacking. So I encourage you to please look at the nutritional facts on the back of your foods, your snacks, anything that you're eating, and you'll be surprised of how much sodium is in there. Again, fresh foods, fresh is always better.
We had a question that was emailed in about what can you do when you're taking care of someone who is a junk food lover, who has no interest in fruits and vegetables, no interest in drinking water, regardless of their health. And as a caregiver, how can you support that individual and not also take it so
Mm-hmm,
emotionally, just because it's upsetting because they're
mm-hmm,
refusing
mm-hmm.
to eat that way?
What I would say there is for you to change your eating habits also. Because if you're going to tell someone else, oh, you shouldn't be eating this, but then they see you eating it. So sometimes just sitting with them and eating it with them, the healthy foods, and of course, then who is bringing this junk food in the home? Who's bringing the junk food in? Are you the one that's bringing it in and then telling them they shouldn't have it? So, because it's hard to get someone to change their habits. And, again, with diabetes, if a piece of cake, okay, take your blood sugar, see how that affected your blood sugar. If it didn't affect it much, okay, a piece of cake a week might be okay. But if you're going to sit and eat a half a cake or these little Debbies and thing all day long, then that's a problem. Again, just remember in everything in moderation, everything in moderation. A little a day because you want to, you quality of life that we want to remember also. So I'll never forget, and I'm sorry to say, I know we're in for time, but it was this psychiatrist told me this one time, and I'm not going to call his name because some of you may know him, but he's in a lot of the assisted living around here and nursing home. And he was in a nursing home. His dad was diabetic. And the staff there now the doctor himself, the psychiatrist, brought some little chocolates for his dad and had it in his drawer. And the nurses came and took it out, got away from him. And he got so mad. He was like, my dad is 92 years old. I'm looking at his quality of life right now. If he wants a piece of chocolate, that's not going to damage that much. So that's why I say that to say everything in moderation, and just you have to look at the whole picture for that family. But I would say, yes, sit down and eat with them, change your eating habit with that person also, because yeah, it's easier said than done to get someone to change.
We had a question. Can you please describe a diabetic condition?
Okay, that's when you're having symptoms. You go in and have your A1C done, and your A1C is within normal level. So, but then if your A1C is a little elevated, that could be in your pre-diabetes. So the doctor might say, okay, we're not going to put you on any medications. We're not going to do anything. I need you to stop. You smoke a lot. Let's cut down on your smoking. Okay, let's get some exercise in there. And then when you go back in, he might tell you to come back in 3 months or 6 months. Let's do an A1C again. Let's see what your levels are, because those are things that those are risk factors that you can change before getting into diabetes or type 2 diabetes. So that's why lifestyle changes is so important, will really help.
A question came in, how much caffeine is recommended per day?
Ooh, that I can't answer. I can look it up real quick. But I think I remember hearing as far as caffeine, and the thing about it, some people, even when they think they're drinking decaffeinated coffee, all coffee has caffeine in it. So it might not be as much as a regular, caffeinated versus decaf. I don't want to say 2 cups a day because that might not be the right answer. Again, let's look at someone, their body weight, their body size. Someone might drink 4 cups of coffee a day, but they're exercising, they're drinking a lot of water, they're doing other things. And someone else might drink 2 cups of coffee a day and they have a set of managed lifestyle where they're sitting on the couch doing nothing, no type of exercises, and that might affect them more than the person that's doing the 4 cups and exercising, drinking, doing a healthy eating lifestyle. So it's an individual thing. The thing about it, when it comes to healthcare and illnesses, there's no cookie cutter. It's not a cookie cutter. And I'm glad of that. It's an individual. So your care plan should be geared towards you and what's going on with you at that time.
So for someone who's looking for how much caffeine is too much, going to the doctor, talking to, when you go on your appointments, check with them to see
Check with them
what
and
would
let
be
them
best for
know how
you.
much coffee. And then your doctor probably will ask you, well, how much coffee do you drink a day? Oh, I drink about 5 cups a day. Or 1 cup a day. So please, yeah, talk with your healthcare provider and they will look at the whole picture to see like, yeah, you really should only be drinking 1 cup a day. So
Thank you. Another question came in. What is normal A1C level?
again, depending on that person, but I think the level is 7.6, something like that, of your A1C.
Another question came in, which is, what is your impression about using Ozempic for weight loss, even though it's supposed to be for a diabetic condition? And I did want to say, I know some of these, I'm not sure, again, you may need to go back to doctors about some of these questions, but do you have any thoughts on that, Bobbie?
Yes. my thought personally, I'm looking at as this is a medication for people with diabetes. Now, if I start taking it, you start taking it, 100 people start taking Ozempic, they're going to run out of the supply for Ozempic for the people that really need it for diabetes. Now, if you are obesely overweight and it's affecting, you have heart conditions now and everything, pre-stroke, things like that, your doctor might prescribe it for you. But we have people that's 180 pounds going out getting Ozempic because they want to be 100 pounds like that. So, again, talk with your healthcare provider.
I know that's a controversial one for
Yeah,
sure.
yeah. So, I mean, like
Definitely.
I said, it depends on what's going on with you, your body weight, your BMI, everything. A doctor might say you are in obese, mortality for obesity. And yes, you need to lose weight. I want you to start on this Ozempic then. But it's just whether people just want to be slim, a size 7, then no.
Well, thank you so, so much, Bobbie. We also had a shout out in the audience that I wanted you to know that you did an excellent job and very thorough. Know your
Oh, thank
topics.
you.
We had other folks also mention how they really enjoyed the presentation. They're looking forward to the recording. So thank you
Awesome.
so,
Thank
so
you guys.
much.
Thank you. Thank you for your time with me.
Well, really appreciate your expertise and your time. And I also want to thank our audience for being here. We know that your time is very valuable as
Yes.
caregivers. So thank you so much for joining us today. I want to invite everybody. Our next caregiver program will be December 13th. That's a Wednesday. We're going to be doing a Dementia Friends information session from 12 to 1. And I wanted to remind everyone to please fill out the survey as you hop offline. Feel free to give us feedback on today's session. You can share comments for Bobbie and let us know what programs you want for next year. We are working on rolling out our next year programming. So please let us know what you're interested in. And again, I just want to thank everyone and especially Bobbie again for your time and expertise. And I hope everybody has a terrific rest of your Wednesday. Thank you so much.
Thank you. Thank you all. Thank you for coming on.
Thanks, Bobbie. You take care.
Okay, can I say one thing? A normal level for the A1C is 5.7 or below. I was near it. I said 7. So 5.7 or below for your A1C.
Thank you, Bobbie.
Okay. Thank you guys. Have a great rest.
Thank you. Take care, everyone.